Today, I want to welcome Harlon Pickett. He is the founder of Eagle Care Health Solutions. Harlan's a leader and advocate for insurance and healthcare industries. He's been championing innovative alternative funding solutions that challenge traditional insurance models, and he's paving the way for more affordable and personalized healthcare options. Anybody that knows my story, knows that I I saw the dark underbelly of the beast, didn't like it. And so I've been looking for people like Harlan to come on Leaders and Legacies. Part of the reason is if you own a business, you want to provide healthcare for your employees, and the costs are getting outrageous. And the good news is there's people like Harlan that are providing alternate solutions to really bring down the cost. So listen in, and it's going to be a neat conversation. Harlan, welcome.
Hey, thank you so very much, Craig. It is an honor to be here, sir.
So I think one of the funniest things you said in the green room was nobody, nobody wakes up and tells their teacher, I want to be an insurance agent when I grow up.
That's true. I mean, said nobody ever, right? Can you see the little kid all dressed up in a suit with a tie, and he's like, and in his little briefcase, and he's ready to go start making those house calls like we did back in the day. But that's that's exactly right. Who wakes up and says, I want to be an insurance agent? Most all of us that fall into that realm got here by accident or just ended up here in some crazy way.
Yeah. So how did you get here? What was your path?
Well, I was in corporate America for about 19 years till corporate America decided it didn't need me anymore. That journey was very interesting. I got to do some pretty cool things in that job. But what I learned is that, man, insurance and all those benefits, they were so affordable. It was so awesome, man. I hardly paid anything for my family to have health care. It was great. And so I was not prepared for when I became an entrepreneur. See, the wonderful thing that happened to me is that corporate America didn't want me anymore because while they have just enough good benefits and they have just enough of a salary to keep you there, but changes in the industry that I was in meant that I was no longer needed. And I'd always dreamed of having my own business and being an entrepreneur, and so it gave me that opportunity. But what you're never ready for, and as I've learned over my years, as I've helped many other people that have been pushed away by corporate America or has decided to take the plunge on their own, is you're just not ready for what individual healthcare looks like. You're not ready to take this on your own. And it's quite the wild world out there, and it's the Wild West. And you're just, for example, we paid, less than $200 a month for my family of four whenever I was working. After I left, I was getting quotes in the $800 to $1,000 range for my family of four. Well, without understanding that the company was paying that big a piece, I thought all these people, these crazy insurance agents, I've always heard you guys were crooks. And now I'm seeing that you're trying to charge me $800 a month for my family's health insurance. So I did this crazy thing, Craig. I said, I'm not going to listen to y'all. I'll sell myself some insurance. I studied for 2 weeks, took the test, passed the test, got appointed with some insurance company and said, holy crap, this stuff's $800 a month.
Wow. For me, I've bought my own insurance a couple times, but the last time I left a job that had insurance, I went out and I bought a high deductible plan for myself. It was $89 a month. And I loved it. It was great. And it's just gotten insane. It's gotten insanely expensive.
Yeah, it really has. And remember, I didn't even know what I should be shopping for whenever I left because my entire career, I was used to going to the doctor for 0 or $2 or $5 or $10. So whenever I left and went out, I thought I had to have that same kind of plan because I didn't know any different. And I promised, my wife told me I needed to have that kind of plan too, right? With two young kids at that time, there's no doubt we were overinsured, but without anyone to explain that to me and explain that I was paying all of this money every month just for the right to see my doctor for $10. That if you really do the math, it makes no sense whatsoever. But I didn't understand it. And most people don't. Most people literally, they want to pay extra so that they can go see their doctor for less. And it makes no financial sense whatsoever until someone explains that to them. And then you don't always get to see the light bulb, Craig, but
Yeah.
sometimes you get to see that light bulb go off and they're like, oh, I get it. But you know who's in the same situation? Employers. Employers are paying all this money so people can have a certain name on their card when that makes no difference. And in fact, many times it prohibits who their employees can actually see and the health care that they have available to them.
And it's a tension. I mean, I don't know. I'm sure there's some just cold-hearted people out there that don't want their employees to have health insurance. But I mean, most great leaders I know want to provide great benefits for their employees. And then they start looking in the cost and they're like, I don't know how I can run a business.
Right.
I don't know how I can keep the business running and provide these benefits.
Well, because it's almost impossible the way the cost has went up. It's over 90% of the businesses in the United States are less than 50 employees. So if you look at that number and you say, okay, so what does that mean? Why do I care? Because if you have less than 50 employees, you're not required to provide, by law, you're not required to provide insurance. Well, most of those companies, unfortunately, don't, or many of them don't, because as to your point, they simply cannot afford to do it. And if they offer something, it may not be that great a benefit. We have a huge number of people in this country that are on HSA compatible or high deductible health plans. Those are designed for people then to open up a separate account to keep money in there to pay for their medical expenses, because an HSA does not cover anything until you've met your deductible. The problem is very few people actually open the account and fund it. The reason why so many people are on HSAs is because that's the low cost plan. And so when employers are offering that, they really believe they're offering a good health plan and access to health care to their employees. But we've got to the point now where 61% of Americans do not go to the physician unless they're sick. So people are not even getting their preventative care. See, an HSA or high deductible health plan, they still allow you to get your preventative care at zero cost. However, what we have found out is many people do not understand that. They say, okay, everything I do, I've got to pay the first dollar until my deductible. They don't understand that your preventative is still covered. So women are skipping mammograms and their well woman exam. Men are skipping their annual physicals. They're skipping their colonoscopies when they're due, even though they would be covered 100%, because they don't understand how these plans work. They see that deductible of $5,000, $6,000, $7,000, $8,000, and they're like, I don't even have health insurance. And they really don't. They're functionally uninsured. I know you've heard that term before. They might
Yeah.
as well not have anything. It's a tough deal to be in.
Well, I remember back in 2010, so I'm here in Austin, the headquarters of Whole Foods, and John Mackey was still the CEO of Whole Foods. And he published something in the Wall Street Journal, and they he got labeled a right-wing nut job, the founder of Whole Foods for pushing it. But he had, I forgot, I think if you worked, it was either 20 or 30 hours a week at Whole Foods, you had a company health plan. It was a high deductible plan. And if I remember correctly, they had a health savings account that Whole Foods would fund to the tune of $1,800 a year. And so that was money to go see the doctor. And he told the story about how his employees loved it,
Yeah.
especially, part-time employees had coverage, which doesn't happen elsewhere. And but he said one of the really neat things was he had unleashed a army of competitive shoppers on the healthcare industry.
And whenever the company funds it that way, it works very, very well. So when you see a company, the problem is, let's go back to what you said earlier. They can hardly, in many cases, afford to provide benefits. So how are they going to be able to fund these plans as well? Whenever it is an HSA that is funded by the company, that it puts everything completely in a different light, because then people have this bucket of money that they can spend. And if he was giving them $1,800, that's a beautiful thing, because most people will never even spend that much. They'll
Yeah.
never spend that much in an entire year, which is why no one ever reaches their deductible when they have the higher deductibles. So if the employer is truly providing access to healthcare like they are in this way, absolutely, the employers are going to be super, super happy because now they have the funds to actually do it. That's a very, very well set up and well thought out plan. And the reason is because when you do have that higher deductible, this is another thing, of course, companies struggle with. This is their answer many times whenever the premiums are fixing to go up. They say, well, let's raise the deductible. Let's raise the deductible. Well, you can only raise the deductible so much before, once again, people don't have access to health care. But if you're following that up and let's just say you're taking your savings and you're putting that in a fund where then they can use that to access health care, two thumbs up on that one, Craig, because that's a well thought out, well designed plan that's going to allow people to actually access the health care that they deserve.
Yeah. So for the businesses, and what was that stat you mentioned? What did you say? 80% of businesses are less?
90% of businesses are less than 50.
I didn't know that. That is wild. And so they are not required by law to provide health care. But again, I think a lot of the people want to provide health care, but the costs have just gone insane. What are the options? What are some of the choices that, people running businesses that want to provide this? What are their options to do something for their employees?
It's a great question. I want to go back for just a second and hit one thing. While they are not required by law, many of them realize that they're required to be competitive.
Yeah.
Right. So that's what they run into is they have to provide benefits, especially in some industries where they have no choice. If they want to get quality personnel and keep them, they've got to provide quality benefits. And what's interesting to me is I'll go back and answer your question now, is the variety of things that are now available. I'll start with one that if you're a small business owner and you haven't looked at this one particular option, this is a game changer, and that's direct primary care. So direct primary care, advanced primary care, a membership-based model that you can either pay for or partially pay for your employees that gives them true access to health care where they can actually go back and rebuild a relationship with a physician. These this model is amazing. It will make a huge difference in the health of your employees and their happiness. Then happy employees, healthy employees, a healthy employee. One of the big differences that people see is the fact that they can see a doctor same day, next day. To give you a crazy example in contrast to a health plan, I recently was speaking in Chicago at Becker's Payers, and I was talking about direct primary care and talking about how we build plans around direct primary care and the same day, next day opportunities to see a physician. When we were done with that, a young lady came up to me from one of the Blue Crosses, Blue Cross Blue Shield Independence in Philadelphia. And she had started working there just a few months earlier. And she said, the first thing that I noticed when I got on our plan, so she was on a Blue Cross Blue Shield Independence plan, is that I had a hard time finding a primary care doctor and no one could see me for 4 to 6 months.
Yeah. Yeah. I mean, that's crazy.
What? And I said, and that's one of your plans. That's one of the plans that you endorse and sell. And she just kind of hung her head. She goes, but can I get one of those that you're talking about? I said, yes, ma'am. And I found her one and she signed up for one and she's already seen that physician. So those are the type of things that are possible. And people don't know, Greg. They don't know that these are out there. But if you could do one thing, if you could only afford to do one thing for your employees, that's the first direction I would go. But yeah, there's a plethora of other things you can do, and I'll be happy to talk about those too.
Well, and something I heard, and maybe you can validate this because I've seen the direct primary care model and it's fascinating, except I'm pretty healthy. I just don't go to the doctor that much. But I saw something that said, hey, if you wake up sick, in some case, you may not even have to go in. They'll do like a
Oh yeah,
quick little telemedicine. I think I saw one person say, occasionally we'll just come visit you. Do you see that happening much?
yeah. There's absolutely various different models out there, and I do want to point out that this is not concierge medicine.
Yeah.
Concierge medicine is very expensive. In many cases, around $6,000 a year per person. That's also called executive medicine. That's not what this is. This is an independent physician who has stepped away from the traditional model. Typically, they do not accept insurance in any way, shape, or form. They only have a panel of their own members. Usually, you're not going to have anyone that has more than 1,000. Typically, they're around 600 to 800, which is why you can get appointments so quickly. But yes, they utilize text messaging. How would you like to have your physician's phone number? Because we see it all the time. Almost everyone that we work with, that we partner with, they're giving their personal phone number out to their members so that if they have something going on. Once again, to your point, they wake up and they're not feeling well. Man, feeling pretty rough this morning. I think the allergies have got me, Dr. Craig. And so he's like, okay, when you get up and around, give me a shout, or you want to do a quick call, or how can I help you? Whatever that is, whatever that looks like with that physician, you go through that process. And like, to your point, no one's going to drag you out of bed, get you to come into the office. No one wants your sick tail in the office anyway, right? I mean, come on, you stay at home and let's take care of you there. They can call you in prescriptions. We have direct primary care. My wife was going to the dentist to get some pretty major work done, let her physician know, and he called her in a little bit lower level pain medication just to get her through a couple of days of that pain medication. That wasn't the dentist. That was her primary care physician letting her know, hey, I've got your back. I understand what's going on. Let me help you out. So there's so much having that relationship, like we heard about in the old days, like we saw in the old movies with the doctor showing up with his bag, right? Taking care of folks. Everyone calls them on the phone. Those days are back again if you want them to be. There are physicians, especially in metropolitan areas, there's tons of them, but you'd be amazed how many there are in some of the country settings as well, that these physicians have stepped away, got rid of that middleman, said goodbye insurance company, let's do this back and have that personal relationship so people actually have health care.
Well, I'll tell you how much the desire is for that. So you live in San Antonio. Is it San Antonio or you?
That's correct. Yes, sir.
Yeah. So I'm in Austin, and I know people who go to a doctor in Marble Falls,
Yeah.
which is like 45 minutes to an hour away from Austin. I'm on the west side of Austin, so it's 45 minutes, but it's a direct primary care where part of the draw is that the doctor's not bought and paid for by Big Pharma. But the other part of the draw is the doctor listens to them. And when they say, hey, I've got this, I need this, they don't get the runaround. They don't have all that hassle that comes from the impersonal relationship. They have a very personal relationship where their doctor knows them and responds to their needs. And they're willing to have a doctor that's basically an hour away just to have that benefit.
Well, the frustration that people have, and if you're an employer, think about this, because this is your employees. The frustration people have with waiting 4 months to see a doctor. I finally get in to see him. I wait 2 hours in the waiting room. I get in and I talk to the nurse about all the stuff that's going on. Okay. The doctor comes in a whirlwind and says, I see you've got da 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 da. Okay. Today we're going to address da da da. I need you to set another appointment to talk about these because we can only talk about this today. So here's what I recommend. Wait, you didn't ask me any questions. This is what I think, Scott. No. I know what's going on. The doctor. And they tell you what's going on. They either do one of two things. And this is all they can do here, Craig, because they only got 5 to 7 minutes, and you're lucky if you get that. We're going to get you some new medications. This one doesn't seem to be working, or we'll put something else along with this one. Or we're going to refer you to a specialist, because my buddy that I play golf with, he is one of the best neurologists you've ever seen. And I think that he's going to be able to help you. Now, let's be honest. You're just getting your quota met through the health system that you're working for to refer to specialists. You can take care of it just like direct primary care does, but you don't give it the time. And the reason is because that system says that you have to see 40 to 60 people a day. So you got to churn through them, baby. You got to churn through them, or you're never going to get through. And that's what actually happens. So when they have the opportunity to sit with a doctor and their appointments are 45 minutes to an hour and a half, many direct primary cares, your very first visit is an hour and a half long as they go through everything. And there is nothing off the table. There's nothing taboo because people withhold information, vital information from their physicians because there's no relationship there. There's no trust there. But once you have built a relationship and you're sitting there talking to someone all of this time and you realize how highly trained and not just highly trained, but how much they care about you, you're more likely to talk about these things and really get to the root of what the problem is and actually get healing. Not just treatment, healing. Let's get to the root of the problem. Let's solve the problem instead of just putting lipstick on that pig, because that's what all most medicine does now, is just put lipstick on a pig and hope that it turns into something else. And unfortunately, it turns into something bad.
And I've run into that a little bit where, and my story, and for those that don't, I was on ventilator for 6 weeks. Well, I was on 25 days first time, I think 8 or 10 days the second time, but I survived COVID, and there's not many of me walking around. And so when I go talk to a doctor, when I'm seeing a new doctor, the first thing I tell them is, don't treat me like the rest of your patients. I'm not normal. My body's not normal and all that. I mean, and as a matter of fact, Saturday I was at an event and I met a doctor, and we were just kind of chatting about something. And I said, yeah, I was in a coma for 6 weeks. And he said, from what? And I said, COVID. And the guy gave me this wild look. It was like he was seeing a ghost, because nobody survived, right?
Right.
And so when I go into a doctor, my physiology is different. And it's funny, some of these doctors that I say, don't treat me like everybody else, I'm not like everybody else. The doctor that I go to now is like, no, you're not. No, you're not. And he gets it. Others where they're like, no, 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 I'm, like you said, I'm the doctor I know. But it takes that deeper, more personal relationship. It takes the right person, the right doctor who's willing to listen. And I like that, the idea of getting back to having a relationship with your doctor, where they know you and you're getting more than that little 5 minutes.
It's life altering. It really is. It's life altering because now you have someone that really has your care at interest, that they're interested in you. Your care is at the top of their mind. Uh, I think about in particular, one of the primary care physicians that we work with, one of the DPCs. If something's going on and they know, that office knows it's going on, they're sending you text, just checking on you. How are
Yeah.
you today? In the case of like my wife's direct primary care physician, she had that work done. He called her in a pain medication on Saturday. This past Saturday, he texted her and says, how are you doing?
Wow.
Your
Wow.
doctor just checking in. How are you doing? That's such a small thing. No, folks, this wasn't her mom. This wasn't her husband. This wasn't, her cousin. This was her physician checking on her after something was done that he didn't have anything to do with, right? He knew she had dental work, and he sent her a text asking, how are you doing?
Wow.
That's
Yeah.
that's what it's all about.
Well, and the other thought that had gone around my head was with the direct primary care, because basically you pay a subscription, you get unlimited visits for the month.
Right.
And if you have one of your employees that has a family with, a bunch of little kids, I mean, the little guys are like sick all the time.
All the time. Yeah. Yeah. We've taken that into consideration. There's no doubt that sometimes memberships, depending on where you're at, can get expensive for direct primary care. But you have to, once again, weigh how much you're going to use the services. However, we do have a product, and I'm not going to say it's everywhere, but in Houston, San Antonio, and Austin, we do have an advanced primary care membership that is only $75 a month for the entire family. So that is providing in-person and virtual care, and also actually behavioral health as well. So we're looking to do anything we can to bring the cost down so that small businesses can provide access to care for their employees. We had our very first company that ever utilized that once we put it together was a small restaurant over off of 35, but between San Antonio and Austin, out of Cibolo, Texas. And they had a huge problem, like any restaurant, they had a huge problem with turnover. Well, they don't have quite the same problem anymore because even though they're only spending $75 for these folks, they don't leave. They don't want, he's like, you gotta push them out the door, right? Because no one wants to lose that benefit. And the other thing that they have had less of a problem with is absenteeism. People have access to a doctor now. When they start feeling bad, they get on the app and get someone taken care of, or they go in. That particular office is open from 9 a.m. to 9 p.m. 7 days a week. And there's 42 locations around those three cities and some on the outskirts of them as well. So for those companies that are looking to add some benefits like that, that's a great place to start. And then you can even wrap them around with other things, medical cost sharing. You can start working with a self-funded plan. That sounds scary, but it's not as scary as it sounds like because you still don't, you really have the same exposure on a self-funded plan as you do on a fully insured plan if it's designed properly, but you actually have control over the benefits of that plan. That's part of what we do is build a custom plan. We ask this crazy question when we meet with someone, Craig. What do you want your health plan to look like? What do you want it to do? We don't really offer off-the-shelf options. We offer options that are customized to each and every single one of our employers. We also have an option now, which we're very, very excited to offer, and that is for companies of 5 or more, 5 W-2 employees or more. We're actually able to offer a plan where all of your health care, including imaging, blood work, hospitalizations, can all be zero cost for your employees.
Wow. Wow. Well, and that kind of leads into something else. And I'd hate for us to end this without capturing this thought. I think one of the challenges that a lot of employers have is what you mentioned earlier. They're competing for resources against companies, massive companies that just have like insane benefit plans. And so they may be thinking, well, I have to provide Blue Cross Blue Shield or, one of these other things. And this other stuff sounds scary, or I may lose employees over that. How do you navigate that? Why does it make sense to move away from something that just seems safe and true to one of these other alternative programs?
No, that's a great question because the old saying is no one ever got fired for offering Blue Cross Blue Shield. That's a mantra of HR departments everywhere. And so change obviously is scary. If we do this and it doesn't work, I get fired. Well, if you're a small business, you don't even have that HR person. You are the HR person. And now you're all worried about what's going to happen if I put this plan out there and then people hate it because they don't have the Blue Cross or United or whatever on the card. What we find out, and this is all part of education, and a lot of times that education has to be part of the ownership too, is we once again ask the question, what do you want your plan to give you? What do you want? 9 out of 10 times, the answer out of the employee's mouth is not Blue Cross. 9 out of 10 times is I want to be able to see my doctor. I don't want to have to wait 4 months. I don't want to, if I need to have something done, because who hasn't had this happen? I need an x-ray. Well, I'm sorry. We don't think you need an x-ray. So we're going to deny that service. I need an MRI. Well, you already had an x-ray. We finally said yes to that. What do you need an MRI for now? Well, personally, I don't need one. My doctor said I need one. Your doctor doesn't know what he's talking about. This is so frustrating to people because they cannot get the care that they need and deserve because insurance companies are making that decision. Well, when we build these plans, we take that out and put in what we call medical utilization management, care navigation. We put in those things so that it's a journey. It's a walk down the pathway of healthcare with someone supporting you. People want Blue Cross or they want United because they feel like those companies have put together, I can go see all of these different doctors because I have this plan. Well, in essence, that's not true at all anymore because less and less doctors are in these networks, especially if you're talking about Obamacare, fewer and fewer take it. But wouldn't you rather go to a high quality doctor instead of a doctor that's just in one of these networks? Well, what do you mean? If they're in the network, they got to be high quality. No, that's just absolutely not true. Absolutely not true. All the numbers that have been looked at by multiple different, entities, there are a lot of bad doctors, and there's nothing that keeps those doctors from being in these networks. We once asked Cigna if we could remove the bottom 25% rated of their physicians and still use their network, and they said absolutely not. Every
Hmm.
physician that is part of the network has just as much a right to be at the top of the list as any other physician. And it's all randomized. So you might get the best neurologist, you might get the worst neurologist, or you could get somebody anywhere in between. And how is that fair to an employee? But I think that's what they run into, is they don't understand. So it really is, Craig, about education, not just with the owner, but with the employees, to make sure they understand access to healthcare is what you're really talking about. You just don't realize what it is you're asking for, because who does? Why would anyone know that? Why would anyone know all these things if there wasn't a reason to know?
Yeah. Well, and I think if I were, well, I am an employer, but I'm just thinking through it. Like, I think I would try to turn it into a recruiting advantage. We have a health plan where you can see your doctor the same day, the same day,
At no,
and at zero cost. Yeah.
at zero.
Yeah. And it's a doctor, not a PA, you know.
It's a doctor.
And I mean, I would, so I think with a marketing mind, I would come in and I would say, don't try to compete with the big guys. They're in their game. It's the old Sun Tzu. When you fight on your opponent's battlefield, the outcome's already determined. Change the battlefield. Fight where they can't. They are not providing plans where you can see your doctor the same day,
That's right.
where your snot-nosed kids can get 10 visits a month because they're sick all the time and it costs you nothing.
That's
So,
right. They're
yeah.
they're kind of locked in. So even whenever they're fully self-funded, which most big companies are fully self-funded, they still go out there and hire one of the big guys, Aetna or Blue Cross or United, to manage their plan. They rent their network, and then that's who manages their plan. Of course, there's also a lot of lawsuits out there about it right now too, because they manage that plan in their best interest, not in that company's best interest, which is why all those lawsuits are coming out right now.
Yeah. Well, Harlan, this has just been really interesting. I so greatly appreciate the work that you're doing. Our current healthcare system is not sustainable. It will collapse. And so I think it's already collapsing under its own weight. And I think it's people like you that are going to be the lifeline, and where the consumer, where the patients and the companies are back in control. Harlan, how can people reach you?
Yeah, the best way to reach me and learn all about me and what we do is actually on LinkedIn. Go out and look for Harlan Pickett on LinkedIn, and you can learn all about me. You can also, of course, go out to our website to check out Eagle Care, and that is eaglecarehealth.com, eaglecarehealth.com. Actually, I think you can even just go to eaglecare.com now, too. So eaglecare.com, and you can find me there as well.
Excellent. Well, all right. Thank you for sharing all that on Leaders and Legacies.
Hey, appreciate so much being here, Craig. Thank you.